Hello, my name is Dr. Brian Reed, and I'm a naturopathic doctor. And this is a video about treating simple, quote unquote, simple cases of yeast overgrowth syndrome. There was a question in response to one of the videos that I posted recently about treating yeast, and just the question was, how do you treat yeast? And that's a really good question. And so inspired by that question, I'm going to make two videos. So this one is about treating quote unquote simple cases of yeast overgrowth syndrome, and then the next one will be about more complex cases. So by simple cases, I basically mean that there's just a yeast overgrowth going on and there aren't other complicating factors, and I'll talk about what those might be in the next video. But with simple overgrowth, it would be, to my mind, just there's maybe digestive tract involvement, maybe sinus involvement, maybe urogenital tract involvement, maybe skin involvement, but there aren't a lot of other things going on. So it really depends on where the yeast is overgrowing. If it's in the gastrointestinal tract, then I would typically recommend a combination of diet to help try to starve out the yeast. It doesn't really make a lot of sense to feed the yeast the foods that they like to eat, because that will encourage them to have more yeast babies. Not that they actually have babies in a traditional sense, but they will replicate more easily when they have more of a food source. And then it's also really important to work with something that will help to kill the yeast off as well. So in my practice, I generally use herbs to do that. There are other agents, certain nutraceuticals, of course, pharmaceutical anti-yeast agents that could be used, but ultimately it's important to work with something that will kill the yeast. So when it's a gastrointestinal yeast overgrowth, then typically I would recommend something like an encapsulated herbal powder combination formula, or possibly use enteric-coated essential oils, or possibly use a combination herbal tincture. So something to help kill things off. If the yeast seems to be more localized to a person's mouth, and I'm not necessarily talking about thrush, but the question that was actually posted about this was around, I'm paraphrasing a bit, but sometimes the person was getting like a film on their teeth that is believed to be associated with yeast. I'm a big fan of applying treatment as directly as possible to the area, to the tissues that are affected. So if a person says, I've got yeast issues in my mouth, well, by golly, we're going to want to use something to swish around in that mouth. And oftentimes it'll be, if say I'm using a tincture to treat, because if it's affecting the mouth, there's a good chance it's probably affecting lower parts of the digestive tract as well. So there's a good chance that I would say, well, maybe go on a combination tincture with the right types of herbs, swish it around in your mouth for 10 to 15 seconds, and then swallow it, and invent some new curse words while doing that, because the herbs taste really bad. They're generally quite bitter and no fun, but at least you're making contact with the tissues in question. If a person had yeast overgrowth in their sinuses, I'd usually recommend incorporating a nasal spray, usually a diluted essential oils nasal spray. I've talked about those in my certain videos about treating mold illness, so kind of similar types of sprays there. And then if a person had an issue with yeast overgrowth in, say, the vaginal canal, then using something like a suppository would probably be something I would consider recommending. You can ultimately get a vaginal candidiasis using oral agents as well, but again, it just makes a lot of sense to apply the treatment to the area in question that's affected. So for simple cases of, simple, not that they're not impactful, not that some folks with, I guess simple is maybe not the best word, for folks who only have a yeast overgrowth issue going on, then those are the types of things that I would consider using. And I'll talk about the more complicated cases coming up in the next video.